Hey there, I'm Dr. Jim, and I want to talk about something very near and dear to me: professional development. I've banked my entire career on it. But why is professional development so important, particularly when you are in your 30s, 40s, 50s, 60s, 70s, or beyond as a professional? Well, regardless of the career path that you've chosen for yourself, professional development is an essential part of staying on top of your game. If you're in healthcare, it becomes even more important to develop and maintain your base of knowledge and your skills throughout your career. Healthcare professionals are the bridge between patients or residents in long term care, science based knowledge, and the policies and practices used to deliver high quality care and treatments. So, the goals of professional development are important. Committing to continuing education, which I know most of you do, and professional development is likely to lead to some very important goals, including the discovery and application of healthcare practices to prevent illnesses and disease, enhance well being, and increase the quality of life and years of the public. And that's what we are trying to do. Healthcare professionals are trusted by the public to provide care that is not only safe, that's basic, but highly effective, efficient, timely, person centered, and equitable. So, what's the difference? We throw around a lot of words, right? Training, continuing education, education, professional development. What's the difference? There are some major differences. Okay, so training, education, and professional development are used interchangeably and are sometimes mistaken to be the exact same thing, but they're not. Training refers to the beginning of understanding a process or function and standardizing it to yield similar and consistent results. So, a good common example in senior care would be easy enough: making a resident's bed. That's basic training. Now, education goes beyond the basics of training and involves processes by which healthcare professionals learn to apply solutions to problems and adapt to new situations as they arise. A care pathway, for instance, is a good example in which an illness has multiple paths of treatment options or best practices in care that lead to positive health outcomes for an elderly resident in senior care. Professional development, on the other hand, how many hands do I have? Completely transcends both training and education and includes areas such as self directed learning, quality improvement, and systems changes. This is a very high level of learning, in other words. It teaches professionals how to apply solutions, identify problems, and focus on one's actual performance. An example is learning new supervisory skills, theory, and methods to manage, say, a special care unit or a wing, a space in a care facility. So, there's a newer concept, by the way. I've been digging into this for years and years and years and years, and I just came across a little while ago a concept called continuing professional development. Now, over the past few years, a new concept in learning has emerged called continuing professional development. And it does differentiate from what I've already talked about: training, education, and even professional development in several ways. Continuing education and professional development are only parts of it, as there are others, including tailored and learner driven education that are both built on broader theories than the other modalities of learning that I've talked about. Continuing professional development incorporates self-learning as well as organizational and systems learning. It focuses on clinical aspects of healthcare and other practice related content. Okay? It can be said to be a far more diverse form of learning and it uses a variety of methods, styles, formats, and environments or learning spaces. It can also be considered a system for maintaining, broadening, and improving knowledge and skills throughout one's professional life. Continuing professional development strives to develop effective practice and promote effective change now. An example of this type of learning is learning new and complex technology for specific health conditions. So, that's my take on learning, on development, and beyond. So, if you're in healthcare, whatever career path you've chosen, we cannot rest on our laurels. We have to continue learning, developing, and even far beyond that. So, I'm Dr. Jim. Keep coming back for more information because I keep researching, and I want to share it with you. Stay in touch. Email me, jim@collinslearning.com. Visit my blog, Dr. Jim Collins. I should know my own blog, drjimcollins.com, ceu.academy, and collinslearning.com. Take care, and I'll see you soon.